Equity around healthcare is so important. Those on the streets were not going to come into our Homeless Services Center for that. So we decided to go to them. We used the model where throwing a backpack over the shoulders of a nurse, pairing with an outreach worker, and more recently with a mental health professional, we could actually begin to meet, understand individuals on the streets where they were. And it's been amazing. We have had over 500 touch points with people. Each time it's so significant because you get closer to building trust and closer to caring for their well-being and giving them the health care that they need.
The bag that I carry with me on outreach is our mobile medical bag. We have Tylenol and Advil. We have bandages and antibiotic ointment. We also carry Narcan with us for our people who may be experiencing substance use. We have a portable EKG. We have all these things that provide screenings to help us recognize potentially life-threatening diseases that we can then take action to earlier than they would have received action for before.
The reason this program is so necessary is that people will not come to you. They think they're fine until they're not. What we were seeing was people coming to us when they were in an emergency state. And we realized if we could use more of a preventative approach, they would not reach that critical state where there was no going back.
When we approach somebody, we don't just see someone on the street who needs housing. We notice that these people have a desire to be seen as an individual person, and we do that. And I think that's one of the most dignifying things that you can do.
There's a man that it took a very long time to allow our outreach team to approach. And finally, when they did approach, there was just a horrible wound that was on his leg. They went back every day encouraging this individual to come back inside. Finally, they agreed to come and just let the nurse practitioner address the wound. And he started to think about his alcohol and drug addiction. And he asked us to help him get help. And he did recover. And we were able to house him. If we had not had that touch point on the streets where he was comfortable, I don't know where he'd be today.
We are aiming to get everyone that we meet stabilized health-wise and into housing. Our goal is to get everyone to a point where they can take control of their own health, they can take control of their whole life, and they can really get into a place where they're safe and able to do more things than they could before.
Right now, we're able to support a team going out once a week. As we think about what is needed though, it's more than that. So our hope is that we can start and actually have multiple teams. And if everybody's going out in different areas, we'll be able to deepen the trust much faster, because right now we have to cover the whole county with one team. And sometimes it just starts with handing them a bottle of water and just saying, "How are you today?" But when it gets to the level where trust is really solid, then there's a conversation. I'm so proud of this program, and I'm so proud of the community for supporting it.